here in Chicago, domestic violence victims and survivors are impacted by a lot of isms. There's racism, there's classism, there's economic injustice. Our services are for men and women, they're for individuals in the LGBTQ plus community. Our doors are absolutely open to everybody. CAWC is actually the oldest domestic violence agency in the city of Chicago. We started the city's first 24-hour hotline. Shortly after that, we opened up the city's first 24-hour emergency domestic violence shelter. Now, it's so much more.
Everyone's seeing an increase in hotline calls. So we know that there's an increase in domestic violence happening in our community in Chicago.
Persons who cause harm have figured out ways to even use the pandemic to further their reach in terms of establishing and maintaining that power and control.
Most of the time, I'm talking with our families or our clients and providing them with information about the rights of Illinois Domestic Violence Act, the rights to have an order of protection, file police reports, criminal charges if they think that's safe.
Once they come, part of what we're going to do is a safety assessment. Based on that, we may call the police with their permission. Everything is client-based, client-centered.
It wasn't even that long ago that CAWC established the first relationship between a hospital and a domestic violence agency. So that alone is astounding, and it's been used as a model for other programs across the country. Having the connection in the healthcare system provides a safe pathway for survivors to flee a partner or an abuser under the guise of going to a medical appointment.
I wish all hospitals had programs like ours. Healthcare providers provide domestic violence screening, asking 3 short questions about domestic violence and seeing this wealth of intervention and resources opening up. It helps victims and survivors feel comfortable and feel safe. So we have to have training on how to ask that question. That's key.
We're on different committees in the hospital systems. There's that macro level outreach that we do, and then the grassroots, on the ground in the hospital.
We also have services at a substance abuse treatment program called Haymarket. Really non-traditional way of providing services for individuals who are struggling with issues of addiction and also domestic violence.
I'm there for them no matter what, and we're making a difference on providing services or the reality of the court.
How we do our work means everything to us. Receiving this award will just open up opportunities for us to take our message to other healthcare institutions.
There's more that needs to be done for prevention of domestic violence. Fund CAWC or other domestic violence agencies.
People can volunteer their time. We're always looking for good people to come in and help us. And then I think the other thing is by spreading the word until CAWC becomes a household name. Our mission pretty much has always been, and it's a lofty one, to end domestic violence.